As time passes, you may notice small changes in the people you love. These changes can sometimes be hard to spot, and you might wonder if it's just part of getting older. But some changes are more than just the effects of time. In the quiet moments of life, the body and mind start to show signs that they are reaching the final stage of life. It's often easy to brush off these signs, assuming they're just part of aging. However, there are subtle but important clues that shouldn't be ignored. One of the first changes you might notice in an elderly person is their behavior. They may seem a little slower, or they may forget things more often. At first, it might seem like nothing out of the ordinary. They may misplace their keys or forget to take their medication from time to time. As small as these changes might seem, they can be important clues that their body and mind are starting to slow down. For example, they may suddenly struggle to remember names or events that were once easy for them. They could get lost in places they know well or have trouble following a conversation. It's not just forgetfulness, it's a gradual unraveling of the mind. The person you once knew for their sharpness and quick wit may now seem lost or confused at times. This can be difficult to watch for family members, as it feels like they are losing pieces of themselves. The emotional toll on the family can be just as hard. Watching someone who was once full of energy withdraw from social interactions can make you feel helpless. The person may stop participating in activities they once enjoyed or might become quieter. They may not express interest in the things that used to excite them. This isn't because they don't care or are being rude. It's simply because their mind is struggling to keep up. A common sign that often gets overlooked is a sudden change in appetite. Many older adults lose their sense of hunger. They may eat smaller portions or skip meals altogether, not because they don't want to eat, but because their body doesn't send the same hunger signals as it once did. The thought of food may no longer bring joy, and eating becomes more of a chore than a pleasure. For some, this leads to unintentional weight loss. Losing weight can be a quiet sign that the body is changing in ways that we don't fully understand. You might notice that their clothes start to hang a little looser or that they need to tighten their belt more often. At first, this might seem like nothing to worry about. But significant weight loss, especially without any effort to lose it, is often a warning sign. The body might not be absorbing nutrients properly anymore. Muscle mass begins to decrease, and essential systems in the body begin to slow down. This loss of muscle mass is a critical sign. It affects more than just appearance. It weakens the body. Movement becomes harder, and balance becomes more of a struggle. The risk of falling increases, which can lead to more serious health complications. This loss of strength also affects the immune system, leaving the body more vulnerable to infections and illnesses. It's easy to push these changes aside as just part of aging. Many people think that losing weight is just a natural consequence of getting older, especially when an older person stops eating as much. But when weight loss continues, despite all efforts to encourage eating, it's important to recognize that the body might be preparing for something deeper. As the body weakens, the person may become more tired than usual. Extreme fatigue can set in, and even simple tasks can become overwhelming. A person who once had energy to go for a walk may now find it difficult to get out of bed. Even holding a conversation may seem like too much effort. Fatigue like this is not simply a sign of getting older. It's the body conserving energy. The organs are slowing down, and the body prioritizes keeping the most important functions running. This causes an overall feeling of tiredness that sleep can't fix. It's a tiredness that's much deeper than what we feel after a long day. The exhaustion can lead to withdrawal from activities. The person may no longer want to engage in the things they once loved. They may stop talking to family and friends, or they may decline invitations to family gatherings. This change in behavior can cause family members to feel sad and confused, not knowing how to help. However, it's important to realize that pushing the person to stay active or forcing them to do things they used to enjoy isn't the right solution. Their body is telling them it needs rest. What's most important is to offer comfort during this time. Let them rest, allow them to take naps, and don't pressure them to do things that drain their energy. Providing a peaceful environment can be more helpful than trying to keep them busy. Another change to look for is a decrease in their mobility. They may stop walking as much, or they may have trouble moving around the house. Simple tasks like getting dressed or standing up may require more effort than before. Again, this is not just a sign of aging. It's the body's way of saying that it's running low on energy and strength. The struggle to move or stand up may be a sign that their muscles are weakening. The body isn't as strong as it once was, and the lack of movement can increase the risk of falls or other injuries. This is why it's so important to provide assistance when needed and ensure that the person has a safe environment to move around in. These early signs may seem small at first, but they are a clear indication that the body is preparing for the final stages of life. Understanding these changes can help family members provide the right care and support. It's not about forcing someone to do more or pushing them to be more active. It's about accepting that their body is slowing down and offering them comfort and care. Recognizing these signs early is the first step in providing the best care possible. It's about understanding that aging isn't just about physical changes. It's about emotional and mental changes too. Accepting that someone you love may be in their final stages of life can be difficult, but it's also a chance to make the most of the time you have left together. In the next part, we'll explore how to handle these changes with compassion and make your loved one's final moments as peaceful as possible. Stay with us as we dive deeper into recognizing and caring for these subtle signs of aging. As we age, one of the most challenging changes is the overwhelming fatigue that takes hold. For many elderly individuals, this fatigue isn't like the tiredness we feel after a long day. It's a deep, unrelenting exhaustion that doesn't go away with rest. In fact, even after a good night's sleep, they may wake up still feeling drained, as if they've never slept at all. This type of fatigue goes beyond physical tiredness. It's a weariness that feels rooted deep in the body, affecting both physical and emotional well-being. Even simple tasks that were once easy, like walking to the kitchen or getting dressed, now feel like monumental efforts. For someone who used to be active and independent, this sudden lack of energy can be confusing and frustrating. They may find themselves unable to do things they once enjoyed, like reading, gardening, or even talking to friends. At first, it may seem like nothing more than just the normal slowing down that comes with age. However, it is essential to recognize that extreme fatigue can be a sign that the body is starting to struggle in ways that go beyond simple aging. As the body ages, its organs begin to slow down. The heart, for example, may no longer pump as efficiently, and the muscles may not receive the same amount of oxygen they once did. This slowdown is part of the natural aging process, but it can also lead to significant weakness in the body. What makes this fatigue so difficult to handle is that it's not just physical. It has a deep emotional impact. Elderly people who were once energetic may become frustrated and upset by their lack of energy. They may feel embarrassed or defeated by their inability to do what they used to do with ease. This sense of helplessness can lead to isolation. They might begin to withdraw from family, friends, and activities they once loved because they no longer have the strength to participate in them. For family members, it can be hard to watch. Seeing a loved one go from being independent and active to struggling with basic tasks is a painful reminder that time is passing. But the best way to help is not by pushing them to do more or encouraging them to keep moving. Instead, it's important to acknowledge their fatigue and allow them the time and space to rest. Pushing them to stay active when their body is asking for rest may cause more harm than good. The emotional toll of fatigue is especially difficult because it can lead to feelings of sadness, confusion, and frustration. The person you once knew, who was always busy, full of life and full of stories, may now become quieter and more withdrawn. This doesn't mean they've lost interest or that they're deliberately shutting others out. It's simply the body's way of saying it needs rest. They may not have the energy to engage in conversations, go for walks, or participate in activities that once brought them joy. In these moments, it's important to remain patient and understanding. Let them rest. Don't push them to be more active than they feel able to be. The goal during this time isn't to force activity, but to ensure they feel supported and comfortable. Sometimes, just sitting beside them, offering quiet companionship, or sharing a soft conversation can make all the difference. Another aspect of fatigue in the elderly is the impact it has on their mobility. As energy levels decrease, movement becomes more difficult. Even standing up from a chair may require more effort than it used to. This lack of energy can make it hard for the elderly person to keep up with the daily tasks they once handled without a second thought. The result is often a decrease in physical activity, which can lead to a cycle of weakness and further fatigue. For family members and caregivers, it can be distressing to watch someone you love struggle with tasks they once did effortlessly. You may feel helpless and unsure of how to help. However, it's important to understand that the best way to provide support is by respecting their need for rest and offering help when needed. Simple things like assisting them with standing, offering to make meals, or helping them with household tasks can relieve some of the pressure. The focus should shift from urging them to keep going to making sure they feel cared for and comfortable. In the face of this fatigue, it's also crucial to take care of the emotional side of things. The elderly often feel a deep sense of loss when they realize their energy levels have changed. They may miss being able to do the things they once did, such as going for walks or engaging in activities with their grandchildren. The sense of loss can be just as painful as the physical limitations they are facing. It's important to remind them, gently, that they are still loved and valued. Even if they can no longer be as active as before, they are still an important part of the family. The moments spent together, whether they are small conversations, shared meals, or quiet companionship, are valuable. In the end, it's not about the activities or the tasks they can no longer do. It's about the love, care, and attention they receive from their family and friends during this time of decline. While fatigue and weakness can be difficult to cope with, they are also part of the natural aging process. Recognizing this and responding with compassion and patience can help both the elderly person and their family navigate this challenging time with grace. By focusing on comfort, offering gentle support, and respecting their need for rest, you can help make their final months as peaceful and fulfilling as possible. The key to dealing with fatigue is understanding that rest is necessary, not a sign of weakness or failure. Providing comfort and space for rest is one of the best ways to care for your loved one during this time. Even if they can no longer do the things they once did, they still need your love, support, and companionship. By offering that, you can help make their remaining time a beautiful, peaceful, and loving experience. As time goes by, one of the most difficult changes to witness in an elderly loved one is the decline in their cognitive abilities. At first, these changes may seem small, like forgetting where they place their keys or struggling to remember recent events. But as time progresses, the changes can become more noticeable and harder to ignore. The sharp mind that once easily solved problems and remembered the smallest details begins to fade. It's a slow process, but it's one that families often find heartbreaking to watch. Cognitive decline doesn't just mean forgetting things. It can also affect how a person interacts with the world around them. The person you once knew for their sharpness and ability to engage in lively conversations may now seem distant or distracted. Conversations that once flowed easily now become more difficult to follow. Simple questions may be met with confusion or blank stares. This shift in cognitive function is more than just forgetfulness. It's the mind's slow retreat from the world. For family members, it can be a painful experience to see a loved one slowly lose their ability to remember things, especially when they forget things that were once so familiar to them. They might forget the names of close friends, family members, or even their own children. Things that once brought joy, like recalling happy memories or sharing stories, now seem like distant, unreachable moments. The emotional toll is significant. Seeing someone who once had a quick mind become forgetful and confused can create a sense of loss. It's not just about the person's memory, it's about the way their entire personality can seem to shift. They may become quieter, less interested in the things they once enjoyed, and more withdrawn from family interactions. This is not a reflection of their feelings toward their loved ones. It's simply the natural progression of cognitive decline. In many cases, as cognitive abilities begin to fade, emotional withdrawal follows closely behind. People who once loved socializing may now avoid family gatherings or withdraw from conversations. The person who once shared everything with their family may now sit silently, staring out the window or lost in their thoughts. This emotional distance is often the hardest part for family members to accept. It can feel as though the person you once knew is slipping away, piece by piece, and it's hard to know how to help. But it's important to recognize that this withdrawal isn't a choice. The person may still feel the same emotions but is unable to express them as clearly as before. They may still feel love, joy, and sadness, but struggle to share these feelings. It's not that they no longer care about their family, it's that their ability to communicate has become limited. Watching a loved one retreat into silence can be frustrating and painful. You may feel helpless, unsure of how to engage with them or what to say. In these moments, it's important to be patient. Understand that the person may still want to communicate but is simply unable to find the right words or keep up with the conversation. Instead of pushing them to talk, try creating a calm and comforting environment where they can feel safe and secure. Sometimes, just sitting together quietly can bring comfort. At times, cognitive decline can also cause feelings of frustration and confusion in the person. They may become upset with themselves for forgetting something or for not being able to keep up with a conversation. It's important to approach these moments with empathy and understanding. Instead of correcting them or pointing out their mistakes, offer reassurance. Let them know that it's okay and that they are still loved and appreciated. The emotional support you offer during these times is just as important as any physical care they receive. Another aspect of cognitive decline is the increased difficulty with day-to-day tasks. Things that were once simple, like cooking a meal or getting dressed, may now require more effort and attention. This can lead to a sense of helplessness, especially if the person feels like they are losing their independence. The pride they once took in doing things for themselves may now be replaced by frustration and a sense of being a burden. This can be hard for family members to witness as they see their loved one struggling to maintain their dignity. While it may be tempting to take over and do everything for them, it's important to find a balance between helping and allowing them to maintain as much independence as possible. Offering assistance when necessary, but also giving them space to try and complete tasks on their own can help them feel empowered, even as their abilities decline. It's a delicate balance and one that may take some time to figure out, but it's important to approach it with patience and respect. Cognitive decline can also lead to changes in behavior. The person may become more agitated or anxious, especially in unfamiliar situations. They may experience mood swings or become easily upset over things that wouldn't have bothered them before. This can be a difficult adjustment for both the person experiencing the decline and their loved ones. It's important to try to identify triggers for these emotional shifts and respond calmly. Creating a routine and maintaining a sense of normalcy can help ease some of the anxiety that comes with cognitive decline. For family members, it can be especially hard when a loved one no longer recognizes them or struggles to remember important events. This can create feelings of sadness and confusion. It's important to understand that this is a part of the process and that the person still feels the love, even if they can't express it in the same way. The person you once knew is still there beneath the surface, even if their cognitive abilities are no longer what they once were. As this decline continues, the role of the caregiver becomes even more vital. The person may need more help with daily activities, but they also need emotional support and reassurance. It's important to continue showing love and kindness, even when it feels like the person is becoming more distant. These moments of connection, even if brief, are still meaningful and can bring comfort to both the person and their family. In conclusion, cognitive decline and emotional withdrawal are natural parts of aging, but they can be difficult to accept. Understanding the signs of this decline can help family members navigate the changes with compassion. Instead of focusing on what's being lost, it's important to cherish the time left together, offering love, support, and patience. Even when communication becomes difficult, your presence and care can still make a significant difference in your loved one's final stages of life. As the body grows older, one of the most noticeable changes is how it reacts to illness and injury. What was once a quick recovery from a minor illness or a small cut now seems to take longer, and sometimes the body just doesn't seem to heal at all. This change is not just frustrating for the person who is experiencing it, but it can also be incredibly difficult for family members to watch. The elderly body becomes more vulnerable, and even the simplest infections or injuries can become serious issues. Frequent infections are a major sign that the body's immune system is starting to weaken. When an elderly person catches a cold or gets a minor cut, it no longer heals quickly. Infections like pneumonia, urinary tract infections, and even skin rashes can be much more difficult to treat than they once were. These infections may not be as obvious as they once were either. You may notice that they don't show the typical signs like fever or chills, but instead may appear more tired or confused. One of the hardest things for family members to accept is that infections that would have been minor for a younger person now seem to become bigger problems. The immune system, once strong and efficient, is no longer able to fight off illness the way it used to. Simple treatments like antibiotics might seem to have less effect, leaving the elderly person in a constant cycle of illness and slow recovery. It's heartbreaking to see someone you love suffer in this way, knowing that their body no longer has the strength it once did. A common sign that something is wrong is when an infection doesn't respond to medication as quickly as it used to. For example, a simple cut or wound that would normally heal in a few days might now take weeks to show any improvement. The person might be given antibiotics, but they don't seem to help as much. The infection may linger, causing pain and discomfort. This can lead to feelings of frustration for both the person experiencing it and their family. It can be especially hard for family members to watch their loved one endure this constant cycle of illness without any clear resolution. But it's not just infections that become more problematic. The healing process itself slows down. Even the smallest injuries, like a paper cut or a bump, can take a long time to heal. Skin becomes thinner and more fragile, making it more prone to bruising and cuts. What would have been a minor injury in younger years now takes much longer to heal, and in some cases, it may not heal properly at all. One of the reasons healing slows down in older adults is that the circulation of blood becomes less efficient. When someone is young, their body can quickly send blood and oxygen to areas that need it, speeding up the healing process. But as we age, this process becomes slower. The body's ability to repair itself and fight off infections is no longer as fast as it once was, which makes even the most routine healing much harder to manage. For families, this slow healing can be difficult to watch. They may feel powerless, knowing that their loved one's body simply can't bounce back the way it used to. But it's important to remember that this is part of the aging process. The body just doesn't function the same way it did when the person was younger, and while it can be hard to accept, it's a natural part of life. What makes this process even harder is the emotional toll it can take. The elderly person who is used to being active and healthy may begin to feel frustrated by their body's inability to heal quickly. They may feel embarrassed or defeated by the constant cycle of illness and slow recovery. This can lead to feelings of isolation and sadness. The person who was once strong and self-sufficient may now feel weak and dependent, which can be difficult to come to terms with. For family members, it can be hard to know how to help. You may want to find a solution to make the healing process faster, but often there is no quick fix. The best thing you can do is to offer comfort and support during these times. This may include helping with simple tasks, offering pain relief, or just being there to listen. Providing comfort in the form of gentle care can make a huge difference in how the person feels during their recovery. It's also important to encourage them to take things slow. When the body is healing, rest is just as important as any treatment. Encouraging your loved one to get enough rest, stay hydrated, and eat nutritious meals can help their body fight off infections and recover. But even with the best care, healing may take longer than expected. It's important to have patience and understand that this is just a part of the aging process. In some cases, the person may need more medical intervention, such as physical therapy, or special treatments for wounds that don't heal as easily. Sometimes they may need to be monitored more closely for infections, especially if they have chronic conditions like diabetes or heart disease. These conditions can make it even harder for the body to heal. It's important to have open communication with doctors and healthcare providers to make sure your loved one gets the best possible care. It's also essential to stay alert to any changes in behavior or health. If the person starts acting differently, becoming more confused, disoriented, or withdrawn, it could be a sign that an infection is progressing or that they are not healing as expected. Keeping track of any symptoms, no matter how small, can help ensure that they get the necessary care in a timely manner. While infections and slow healing can be frustrating and painful, they are a part of the aging process. The best way to handle these changes is with patience, understanding, and care. It may not always be easy, but offering comfort and being present for your loved one during this time can make a world of difference. Remember that the goal isn't to fix everything, but to make them feel loved, supported, and cared for as they navigate this challenging stage of life. As the body nears the final stages of life, some of the most noticeable and concerning changes happen in the way it breathes and circulates blood. These changes are not always immediately obvious, but over time, they become impossible to ignore. Breathing patterns become irregular, and the body's ability to circulate blood efficiently slows down. These shifts are natural, but for families, they can be difficult to accept. One of the first signs that breathing is changing is the increase in shortness of breath. The person may find it harder to catch their breath after simple activities, like walking across the room or even standing up. This is often the result of weakened muscles and a reduction in the body's ability to move oxygen efficiently. The effort to breathe becomes greater, and sometimes even a small movement can cause someone to feel winded. For family members, it's distressing to see a loved one struggle with something as basic as breathing. It's easy to feel helpless, especially when you see them trying to catch their breath or feeling out of breath after walking a short distance. In many cases, you might notice that the person has to take more breaks during daily activities or may avoid doing things they once enjoyed because they can't keep up with the physical effort. In the final stages of life, breathing patterns may start to change dramatically. You might notice a shift from normal, steady breathing to more irregular patterns. The person might take a few quick breaths, followed by a longer pause, or their breaths may become shallow and labored. This is a natural process as the body begins to conserve energy and slow down. These changes can be alarming, especially if you've never seen someone struggle with breathing in this way before. One of the more noticeable breathing changes that often occurs near the end of life is called Cheney-Stokes respiration. This is when the person's breathing alternates between deep, rapid breaths and periods of no breathing at all. These pauses may last for several seconds or even longer. While this might seem frightening, it is actually a common sign that the body is preparing for its final moments. Another sign to watch for is a decrease in the warmth of the body. The hands, feet, and even the nose or ears may become cold to the touch. This happens because the heart is no longer pumping blood as efficiently as it once did. As a result, blood is directed away from the extremities to focus on keeping the vital organs functioning. This is a normal part of the body's transition but can be unsettling for families who are not used to seeing it. Along with the coldness in the extremities, the skin might also start to change. It may become pale, or in some cases it may take on a bluish tint, especially around the fingers and toes. This happens because the blood is no longer circulating, as it should. The skin, which normally receives a steady supply of oxygenated blood, now begins to show signs of the body's slowdown. These breathing and circulation changes are a signal that the body is no longer functioning in the way it used. 2. The heart isn't pumping as strongly, and the lungs are struggling to bring in enough oxygen. It's important to understand that these changes are not something that can be fixed or reversed. They are part of the body's natural process of winding down. For families, these changes can be difficult to witness. It's natural to feel a deep sense of sadness and helplessness when you see someone you love struggling to breathe or becoming weaker. You may want to intervene or try to help them breathe better, but the most important thing you can do during this time is to offer comfort and reassurance. While it's difficult to watch someone lose their ability to move freely or breathe easily, it's important to remember that these physical signs are a part of the end-of-life process. There is no need to panic. Instead, focus on making your loved one feel as comfortable as possible. This might include helping them find a comfortable position to breathe more easily, propping them up with pillows, or offering gentle reminders to relax. One of the best things you can do during this time is to create a peaceful environment. Keep the room calm and quiet, and offer reassurance when they seem confused or upset. Let them know they are not alone, and that you are there for them. Even if they can no longer speak or respond the way they once did, they can still feel your presence and your love. It's also important to keep in mind that the person's needs may change as their breathing and circulation continue to decline. They may need more help staying comfortable, or they may need to rest more often. Don't be afraid to ask their healthcare providers for advice on how to manage their symptoms and ensure they are as comfortable as possible. The goal is to provide comfort, not to cure the illness. As the body's energy reserves become depleted, the person may also find it harder to stay awake for long periods of time. They may sleep more and become less responsive. This is a natural part of the body preparing for the end. It's important to allow them the rest they need, but also to stay present, speaking softly and offering comfort even if they don't respond. One of the hardest parts of watching someone you love go through these changes is the feeling of helplessness. You may wish there was something more you could do to help them breathe easier or to bring back their energy, but the most important thing you can offer is your presence. Your love and care are what matter most during this time. In the end, it's not about fixing the situation, but about making the final moments as peaceful and comforting as possible. While it's natural to feel sadness and fear during this stage, try to focus on the love you can offer. The physical changes your loved one is experiencing are signs that their body is naturally preparing to let go. By offering comfort and support, you can help make their transition smoother and ensure that their final moments are filled with peace and dignity.